name is Cleo Navarro and my injury topic is opioid addiction. So some background on the opioid crisis. The group that is most affected is African American adult men. As for the areas that are most affected is the Appalachian states, with West Virginia being the state with the highest rate of opioid overdoses. The morbidity rate. There are 4.1 fatal drug overdoses for every 100,000 black men in the U.S. Mortality rates. The death rate due to opioid overdoses amongst black men in the U.S. has tripled and increased to 213% during 2020. As for annual costs, it cost the U.S. $1.5 trillion in 2020 to treat the opioid epidemic, with the U.S. announcing $1.5 billion to all U.S. states and territories to address the epidemic. As for additional information, recent increases in deaths have been largely attributed to the legal manufacturing of fentanyl. Literature review. The opioid addiction interventions. There has been the implementation of naloxone distribution programs that reverse opioid overdoses. Naloxone is the medicine that can quickly reverse an opioid overdose, and studies have shown from the CDC that one of the limitations to naloxone is little naloxone is being dispensed in many parts of the country that need it the most. The second literature review. Using medications for treatment, including Suboxone and Subutex, is one of the medicines that can be used to treat opioid addiction, but the limitations to the treatment are that only 1/3 of opioid-dependent patients at these types of programs receive these medication due to almost all U.S. states not having sufficient treatment capacity to provide these medication-assisted therapies to the patients who need it the most. As for my 3 proposed interventions, the first intervention is to educate young people and spread awareness about the dangers of opioid addiction and fentanyl-laced opioids, and implementing this through educational programs and middle and high schools. This is a primary prevention on protecting the most vulnerable from becoming opioid dependent. The temporal phase is that many young people across the U.S. are vulnerable to opioid addiction due to factors such as early life adversities, history of family substance abuse, or just personal history of substance abuse. Johns Hopkins Medicine found that 20 million Americans aged 12 years and older are affected by substance abuse disorders, and 91,000 drug overdoses in the U.S. were recorded in 2020. In 2020, deaths involving synthetic opioids, mainly fentanyl, continued to increase, with 56,516 overdose deaths reported. The agent vehicle factors are high cases of accidental overdoses from fentanyl-laced opioids and people having lower tolerance for opioids. The physical environment is important to monitor and regulate the supply and seize it and test it for fentanyl. Also looking at the number of young people who have developed substance abuse disorders, as well as seeing the number of those who have died due to opioid overdoses. It is also to monitor how widespread the issue is, and the social cultural environment that has influences the increase in laced opioids coming into the U.S. from China and Mexico. Also, this intervention focuses on the 3 E's of injury prevention through education, as it will educate young people about the danger of opioids and tell them to remain vigilant about the possible laced opioids that are being illegally distributed. As for the proposed intervention for the second is passing stricter regulations and laws to limit opioid prescriptions unless absolutely necessary for patients, and co-prescribing naloxone. This is focused on mitigating and preventing injury by limiting the number of opioid prescriptions given to patients, as current opioid prescriptions are incredibly high across the U.S., with this distribution rate of being 81.3 prescriptions per 100,000 persons in the U.S. This is a secondary prevention that is focused on reducing the potential risk of opioid prescription overdoses, as the risk for opioid overdose has increased over the years. This educational aspect is part of the 3 E's of injury prevention, as in 2016 the CDC began to recommend co-prescriptions in some cases. The human factors and agents that are causing this is pharmaceutical companies have been aggressively pushing the overprescription of opioids, and the human also factors is that doctors are overprescribing opioids because they are pressured to aggressively treat the pain of their patients. As for the physical environment is that there's overprescriptions per capita, and some people may not be aware. As for the last injury prevention, it's focused on the increase and distribution of naloxone and encouraging state laws to support and expand laws that already permit naloxone distribution, as naloxone comes in 3 forms: nasal spray, auto-injector, and injectables. And this is a tertiary prevention and mitigates the factors that arise with opioid dependence, because there is proven facts that naloxone helps. As for the social cultural factors is that people need to be aware of how to use the naloxone. These are my references. Thank you for watching.